Faithfully speaking, I speaking love, speaking hope, speaking peace, faithfully speaking. Come on, stick it into your day. Put a smile on your face. Hold your head up high. It's already okay.
And I'm just faithfully speaking today. Good afternoon, good evening, everyone who decided to come with me from being on the air to right here to this wonderful live podcast of Faithfully Speaking, a good, healthy, positive podcast of great information, conversation on various topics where we indeed speak life into every topic, every situation that we discuss, because we know that God is life, and behind all situations, there's always a great situation. So today, I am your host, Melissa Wade in the Water. Thank you so very much for hanging out with us. And we're going to talk about our men today. Yes. If you invited your man, your husband, your uncle, your dad to join us, by all means, if they're not on here, tell them to come back and watch the show once we're finished, okay? Because we're going to have some great information to talk about our men and their health, especially when it comes to going to the doctor and health screenings. Y'all know when we talk about take a loved one to the doctor day, 9 times out of 10, we're talking about taking our husbands or taking our fathers or taking our uncles, those men who say, hey, I don't want to go to the doctor, haven't been in such a long time. I know I shared this story on the air about an uncle of mine who actually passed away. He fell asleep on the couch and never woke up. And from his children, they were like, he hadn't been to the hospital in years. Come to find out after the autopsy, he had had a stroke and everything. And because he hadn't had checkups, no one knew what was going on with him. Well, you know what? We're speaking life. We're speaking faith into it now. We're going to make sure that our men know more about their health. So here to say amen and yay, Melissa, that's with me are some friends of mine from Duke Health. Please help me welcome to the podcast today, Kirsten Ingram and Jeff Ford.
Thank you for having us.
Hi. How are you?
Well, today. Thank you for having us.
Oh, thank you so very much for agreeing to be on Faithfully Speaking today for such a wonderful topic that we really need to highlight even more than just today. But you know what? We got to get started somewhere. So thank you both so very much for being, just representatives of Duke Health and wanting to come on and talk to us about our men's health, especially when it comes to cancer. So as we get started, let's start off by just kind of introducing ourselves. Kirsten Ingram, Jeff Ford, you're both wonderful representatives, as I mentioned, from Duke Health and the Cancer Institute there. Kirsten, we're going to start off with you. Just tell us a little bit about yourself and your background.
Thank you so much, Melissa. My name is Kirsten Ingraham. I currently serve as the Assistant Director with the Community Outreach Engagement and Equity team here at the Duke Cancer Institute. I've been working in this space in regards to tobacco prevention and cancer prevention for a little over 20 years now. So it's a pleasure and honor to be able to serve in this capacity to give back to the men in our community.
And I do have to say, I asked Kirsten earlier, I said, are you officially a doctor with the MPH? She says, not yet, but I'm working on it. So I love that answer. So yeah, blessings to you on that journey. We'll be talking to you real soon as Dr. Ingraham. Amen.
Amen.
All right, Brother Jeff, how are you?
I am well. I am Jeff Ford, and I serve on the Duke Cancer Institute Community Advisory Council. I've been on the Community Advisory Council for about 4 to 5 years right now, and I represent the Men's Health Council, Durham County Men's Health Council, on that Community Advisory Council. So I'm here to talk about men's health and how we can do a better job in communicating with our men.
We definitely need that information, Jeff. So let's just jump into it today. And Jeff, since you said that you're representing the men, you want to get out the information of how we can help our men find out more or be more engaged when it comes to their health. Why is it important for us to be focused or to focus on men's health?
Well, first of all, men are at a higher risk of disease and cancers, so we need to. They're at higher risk of heart disease. They're at higher risk of HIV. They're at higher risk of unique things to us like prostate cancer. So we need to make sure that we are addressing those issues and getting that information out on best ways to address those issues that are disproportionately affects African American men and men of color most of the time. So it's my job to make sure that we address those disparities.
Absolutely. Now, how can you give us some tips, maybe some, encouraging words of how we can encourage our men to go to these checkups, to get these screenings? What can we say to them, Jeff, other than, hey, I'm going to go with you?
Well, one of the things that I always find effective is that I tell my story about how two of my brothers had cancer. And I noted that one of them had colon cancer and passed away. Another one had liver cancer and passed away. And I just share with my audience about how it's important to get those checkups, because basically, if you don't, your family suffers those losses, and you want to make sure that you're at your best health, that you can be able to be around for your grandchildren, your children, and also, just to contribute to your community. So you want to make sure you are vested in your health so you can make your community better, make your family stronger, and just continue to live a life of a positive legacy.
Now, Jeff, what are some of the common misconceptions? When it comes to cancer and we talk about cancer, we usually think about the women because when we talk about cancer, we think breast cancer and even with the American Cancer Society just kind of launching out that investigation, one of the largest researches that they're doing to find out why Black women are dying mostly from cancer. Not that they're being diagnosed more, it's just that we're dying more. So the spotlight has been mostly on women. So what are maybe, would you say, are some of the stigmas or the misconceptions when it comes to men's health, and especially regarding cancer? I guess I probably just named one, and that we don't necessarily highlight it as much.
Yeah, we don't highlight it, but also I think sometimes it's from a cultural standpoint, we don't, we as men sometimes, we'll walk off stuff. We think we can walk stuff off and we'll be okay. No, it's important that when you feel like something ain't right, we know our bodies, we need to go to the doctor. So my thing is, if you see something or feel something, you need to go and check it out with the doctor. Don't think you can just walk it off or time will just take care of it. So that's part of the misconception, I think, from a cultural standpoint, but also access to healthcare is an issue as well. Mm-hmm. So if you don't have the insurance from your company or for your jobs and things like that, you might think it's too expensive to go to places. That's why it's important to go to these men's health screens that the Duke has set up on June 1st and June 2nd, because they're free. A lot of times you think these things are really expensive, and they are sometimes, but if you have like a Duke Cancer Institute offering these things free, that's when you need to go.
And we're going to find out more about the free health screening you're talking about. Kirsten, if you would like to jump into it about, any of the stigmas, misconceptions, jump right on in and let us know, the information that you would like to share as well.
Awesome. Thank you. And, definitely to Jeff's point, in regards to when little boys are going to the doctors, they're going in relation to sports. Young ladies, when we're going to the doctors, it starts at a much younger age. And we're going on a more consistent, frequent basis based on just the cycle of life for a lady. And so just making sure that we make that concerted effort to share and encourage the men in our lives as ladies to come out and to receive the screenings that they need.
Yeah, you're absolutely right. We as women, when we go to the doctors, we go on a more personal note, more so than an athletic note, and then as men get older, they find out, hey, I need to go on a more personal note, but they're not used to it. You're right. It's not in their know of saying, hey, I'm going to
Being
go
a-
to the doctor to ask about my blood pressure, to ask about this, because if they're athletes, they're usually pretty healthy. And so now we need to make sure that we say, hey, look, you need to start. It needs to become a part of your lifestyle. As Jeff mentioned, you need to make sure that this is something that we do on a regular basis. Either one of you, how early should a man or a Black man get screened for certain things, such as, prostate cancer, colon cancer, things like that? And I know you mentioned, Jeff, that, Black men are at a higher risk than anyone else, such as the women are. So how early or what age would you say a Black man needs to go and make sure that he is screened for these things?
Yeah,
I think
and go ahead. Go ahead.
um,
You got it, Kirsten.
Kirsten, you go ahead first, and we'll come back to Jeff.
I apologize, Jeff. I think the biggest thing is you have to establish a relationship with your primary care provider, because there are a lot of different factors that will impact when you need to go and begin the different cancer screenings. If you have a family history of different cancers, that will impact when you need to go and receive your first screening. But you really need to work in tandem and really as a symphony with your primary care provider to say, okay, this is when I need to do this, and working with the healthcare system that you're working with, that your doctor is located with, to make sure you're getting those appropriate screenings in accordance to the recommendations.
Yeah. And Jeff, I know yours is a little more personal because, like you said, you had two brothers. So what would your suggestion be?
Yeah, I would just say stuff is like this. It was like a shared decision making, something close to what Kirsten was saying. You have to make a shared decision. Doctors always suggest certain things. I've had doctors that tell me for colon cancer, you should start looking at 45 unless you have a health history. For prostate cancer, again, the average age might be 50, but if you have a family history, to do it earlier. So that's where that shared decision making comes in, where the doctor can tell you, this is the age that I suggested, but if you have this family history, you probably need to come in earlier.
Absolutely. That family history is definitely prevalent. It's very important to look at in starting it earlier. So let's talk about this great event you all are having. Dr. Ingram, tell us about this men's health screening event that's coming up in June. Give us, locations, dates, and things like that, because it's free. First of all, we want to let everybody know, so the men don't have to worry about paying anything. The women that are bringing them don't have to worry about paying anything. Sounds like a great event. Tell us more.
Thanks so much. Yes, the event is Duke's way of giving back to the community. The event has been happening for a little over 30 years now. And
Wow.
so we will be having the event on Saturday, June 1st from 8 a.m. until 12 p.m. at Lincoln Community Health Center. There we will be offering prostate, colon, skin cancer screenings. We will have those with our colleagues from the representative dermatology departments from GU. Also, we'll be working with our colleagues in primary care and urology for the screenings. In addition, we will be offering diabetes risk assessments, and for individuals where it's indicated where they need to receive an A1C test, they will receive an A1C test. And there have been times when someone has had an A1C screening, and the results were so high, their A1C was so high, they were able to talk in real time to an endocrinologist. And so Duke Endocrinology is there. We have made provisions available that day on site. If someone needs to have an appointment, we will be able to make sure that they have appointments in their hand for appropriate conditions that they may have that day. So that will be on Saturday, June 1st. And then on Sunday, June 2nd, from 12 p.m. to 4 p.m. So you can come after church in your Sunday best. Yeah. Definitely. We will be at Duke Primary Care Crowsdale. And again, offering the same cancer screenings as well. And a few other ones that I did not include previously is we will be offering lung cancer risk assessments as well at both facilities, and making appropriate referrals as needed. In addition, we also will be performing blood pressure checks. And again, we have had years where gentlemen have literally been in hypertensive crisis. And again, being able to have someone, a provider there on site, to evaluate the patient and then make the appropriate referral as needed. And also making sure that they have referrals and that they're engaged in the healthcare system. At the end of the day, it's a great way to, one, come out and fellowship with others in the community, but also, as we have as our theme, get in the game, know your scores at the end of the day. It really is a great way for you to kind of get that parameter. We also will have other healthcare related vendors there as well. On Saturday, we'll be providing extra information to our community members. And at the end of the day, if someone needs a primary care provider, we have our patient navigation team, and they will make sure that we are linking up our patients so that they do have a medical home. So
that was going to be one of my questions. Absolutely. Because it's free and open to the public. Will they need to register, proof of any kind of insurance when they come in? Or is there anything specific they need to bring with them if they come and want to get some of these screenings done?
Excellent point. There is no pre-registration required. The men are welcome to come as they are. We do not need any license or form of ID for someone to come and enjoy the services. There's no cost or pre-registration with it. The day of the event, we do have a scorecard in which we will ask information such as your name and ways that we can get in touch with you in case you have abnormal findings with your results. But that information is kept strictly confidential in adherence to Duke Health policies.
I'm telling you, I am loving this. Go Duke Health. That's what it's all about. Truly giving back to the community. I'm absolutely loving it. And you say this has been going on for 30 years?
Yes.
Jeff, you hadn't called me before now?
I'm sorry. But I do want to just add, I do want to add something though, kind of with the health screenings also. One of the things that is so beneficial also is that if you can kind of take these screenings and you just get these warning signs. Sometimes you don't have the high blood pressure and the diabetes diagnosis, but those things also can help you be preventive. So if you see your numbers starting to creep up, you can start making some lifestyle changes where you can exercise, start eating a little healthier, started meditating. But you can do these things also based upon those screenings, because you'll say, hey, my A1C was 5.7 last year, but now this year is 6.1. So what can I do to make sure I get it back down? So it's those type of things also that are very important to get these screenings as well. It doesn't always have to be bad news. It just needs to be some news that you can understand that, hey, I might have to make some changes in my life as I get older, or way I'm eating, or the way I'm exercising.
Yeah, it's all a lifestyle change. I agree with you, Jeff, on that. My mom always said, she was a nurse, me growing up, it's better to know than not to know, because then you can take care of it. And it's better to catch it early than later. And so who would you all, both of you, either one of you, suggest, be the ones that are watching and listening right now? You might have a loved one or a man who hasn't gone to the doctor for a while, so he doesn't know his numbers. Would he be one of those that you say, hey, look, if it's in their history, if it's in their past, bring them to this screening, bring them to this health fair?
For me, I would say that's a definite. And if you don't have a doctor, that's another one. If you don't have a primary physician, and if you don't go to the doctor at least once a year, these are primary people who need to come to these screenings.
Kirsten?
Definitely. And, one thing to piggyback off of what Jeff said earlier in regards to the preventative aspects and the diet and exercise, on site, we do have experts with that will be providing diet and exercise consultations on site. And we do also have the ability to make referrals, and that service is provided by Durham County Department of Public Health. And they've been a long time partner in that space, and really just having that opportunity to have those conversations.
This has been some wonderful information. Thank you all so very much for even wanting to come on Faithfully Speaking. Everyone that's watching right now, we're going to put this on our social media. It's going to live there. It's going to live on our website. I want you to share it, because the event is not happening until June 1st, June 2nd. So you have a little time. Make sure you share it with as many people as possible, especially our men. Take a loved one to the doctor. Take our men. Let's make sure that we encourage our men to take care of themselves, such as Jeff has done. And he is truly a wonderful advocate and an example. And Kirsten, thank you for all that you do there at Duke. Both of you are wonderful representatives. Thank you so very much for joining us today. Before we close out, is there anything that you would like to say before we go, Jeff?
Just want to encourage men to come on out. Like I said, it's better to know than not to know, and you can't stick your head in the sand like an ostrich. Just make sure we come on out and kind of get those numbers so we'll know what our plan and course of action needs to be.
Absolutely. Kirsten, is there a website, before you close out, is there a website for those who are watching right now that maybe they can go and actually see this listed out if they want to print it out and find out exactly when and where to keep it with them?
Definitely, there is a website, and I'll make sure that we have that information over to your team to share out to the listeners.
All right. Well, thank you both so very much. Again, June 1st and June 2nd. This the free men's health screening, as you see there on the screen right now. It will run through Saturday and Sunday, absolutely free and open to the public. Compliments of our friends there at Duke Health, reaching out to our community. That's what it's all about. That's where the healing begins, because we are our brothers and our sisters keepers. And I appreciate you both for joining us today.
Thank you so much for having us.
You're welcome. All right,
Thank
Brother
you.
Jeff.
Appreciate being on.
You're very welcome. All right, as we wrap up another podcast today of Faithfully Speaking, until next time, we're going to continue to speak life into every situation because God's got our back. Until next time, God bless you. We love you. Grace and peace.